One, we want to thank you for volunteering your time to be a coach. Tonight, part of what we needed you to come up for is a concussion seminar based on some changes to some new Nebraska state laws that will go in effect towards the end of our season. We need to have every one of our coaches go through this seminar, and Dr. Imig has graciously come up to provide the seminar today and hopefully answer any questions that you might have. After tonight, we will have this recorded so we can post it on our website, but we wanted the first take to try to gather as many of you as we could to make sure that if there's questions, concerns, those type of things, that you had a recourse to ask questions. So, thank you, Doctor.
Hi, I'm Dr. Carmela Imig. I'm a family practice physician here in Grand Rapids. See a lot of familiar faces. I was not too long ago in your spot. Today I'm going to talk about concussions, and football probably has the majority of the press on concussions, but baseball is also in there. And the definition of concussions kind of made a change over the last few years because we're now seeing the ramifications long term of having a concussion. A lot of the NFL players and even Muhammad Ali has had brain damage because of repetitive brain injury. So the new definition is mild traumatic brain injury, neurometabolic dysfunction, and not just a structural brain injury. Now, what this means is that there's some chemical changes that happen in the brain because of an injury. And I had a great prop for my talk a couple of weeks ago to the softball, but it's not here anymore, so sorry that this looks like urine. This is to demonstrate the injury that a brain has, okay? The head is surrounded by bone, okay, and the brain is kind of a gelatinous type material, and the injury that happens when you get a brain injury is, one, you hit something, but then there's the recoil. And then we call this the coup contre coup, okay? So boom and boom. And so, yeah, they might have an injury on the first hit, but what happened afterwards, okay? And it is becoming a lot more evident as a lot more players younger are starting to play a lot of sports that this really is important, okay? So the definition does not mean just to lose consciousness. They might, and that's a big deal because you're going to call the squad and everything if they do. But the object of today is to let you know the not so evident symptoms of a concussion, because the kids do need to be withdrawn from activity if they do have that. Okay? Now I'm going to have you go to the concussion signs and symptoms that are on your cards. These are kind of a laminated business card, so you can have on your clipboard or billfold or what have you, so you can easily look at it. Okay? So dazed and stunned, unsure of the game score or who they're playing, lack of coordination. You know, you always see some kids kind of come up and do this. That is a symptom. They should be pulled from the game. You should not shake it off. Okay? They should be pulled from the game. Okay? And if their symptoms do not go away within 15 minutes, they should not be allowed to return that day. Okay? But they should be allowed, you should remove them from that play at that time. You need to keep reassessing them. And again, if symptoms don't clear in 15 minutes, they should not return that day. And if their symptoms linger on for over an hour, they probably need to see a medical professional. It doesn't have to necessarily be that day, but probably the next day. Because then if it's lasting that long, they actually need to be out of commission for 1 week. Not just that day, but 1 week. And that is to let the brain heal. Because with this, again, this is just an injury, just like if you sprained your ankle. And what happens when you sprain an ankle? What happens?
Hurt, swelling,
Swelling. The brain doesn't have too much place to go because it's covered by a bony case. Okay? The only way it can go, besides a little mild swelling, is down. And then people die. So this is a real big thing. Okay? And you guys don't want to be the ones liable for this, so be on the safe side. You know, it's much better to take care of your kid than to win the game. Okay? Again, going down there, behavior, mood changes, that's usually later. Forget events prior to injury, that might be the case. Might not remember that spectacular play that Johnny made. Headache, nausea, vomiting, balance problems, and dizziness. That's probably, that and headache are the 1 and 2 symptoms that I see for post-concussion. Those two asterisks. They've got those, then they do have a concussion. And they should not return. If it's going on over an hour, they should not return for a whole week. This means not only physical activity, PE, baseball, what have you, but this also means, this is interesting, they shouldn't use their texting, they shouldn't use any, it's not, all the gaming that they do. I'm not even sure which one's up to date right now. Yes?
Is it now also recommended that they not really do anything at school as well?
I was getting to that as an interesting point. They have actually thought that kids should stay out of school for this. Now, with the truancy laws out there, you know, we really haven't pushed that as medical professionals because of the truancy law. But that has been brought up that kids should actually rest their brains and not read, not take tests, you know, not listen to teachers talking to them and everything. But yes, that is something that they've talked about, but there are other laws that are kind of prohibiting some of that from happening. But it is true that the more they rest their brains, the faster they're getting to back to activity. Because the week starts after the symptoms have gone away. So if he gets clocked in the head and he's in a little daze, you keep him out and his symptoms have been going, and he's still dizzy and has a headache. Let's say this happened on Monday. If he's still dizzy and has a headache Thursday and it goes away Friday, he does not return until the next Friday. So he's very well, he or she's going to be out for a longer period. Okay? But it is very important that you use these guidelines because you're the end all. You're the one that puts them in the game or not. And parents should know this too, and that sounds great, that's going to be on the website, because sometimes they're like, just get out there, you're fine. But this is really important stuff. Okay? And you can see the rest of the things there. When I see the kids in the office, I have them do various things. It's not just, how are you feeling? I actually have them do various coordination things that they have to do. They have to balance themselves, like this, and closing their eyes. That's hard to do when you're fine. so let alone if you have an injury and they really can't do it. You know, they're like, whoa, okay. You know, we do the drug test. But there's a battery of testing. And then I also ask them questions about calculations and their memory. So we really are getting into this, what we call that neurometabolic dysfunction, because it is more than just, you got hit in the head. It really does affect the brain. Okay? Now, when to seek help? Well, again, if they lose consciousness, you really should have them go into the emergency room. Okay? Because they may also have a neck injury to go along with that, and you don't want to be liable for that. So be on the safe side. Okay? On the flip side, the card is questions to ask the athlete. Okay? And there's 11 of them there. Any failure means they've got a problem. Because they should know these things. Okay? Now, okay, maybe at a lower level, maybe, Stan is out there catching butterflies or something and might not really know the score. But the more you're up into the level, they should be in the game. And if they are not, you really need to pull them. Okay? And then go back later in 15 minutes. Reassess them. That's going to tell you if they should go back that day. Because if those symptoms are not gone in 15 minutes, they're out that day. Okay? Now, from a medical standpoint, when do we allow them to go back to play? Well, there's 3 criteria that need to be met. One is they need to be symptom-free at rest, so no headache, no dizziness, or other symptoms when they're at rest. 2, they need to be symptom-free with cognitive and physical exertion, which means, like when I see them in the office, get their symptoms back. They're not ready to go back to play. Okay? Now, the cognitive exertion is, I give them calculations and some other things that they have to use their brain to think about. Okay? And if they mess that up, they're not ready to go back. Okay? And then the third one is normal neurocognitive data and objective evaluation. This is some of those balance things, some of that neurologic function that I'm assessing. If they pass all three, then I'll allow them to go back. Okay? But again, it may be a week or more since the injury that they would return, because it's, again, after the symptoms go away. And I really stress to the parents and the kids that this is so important that you don't want to lie about it. Because, you know, everybody wants to play. But you really, really got to stick to those rules. And if you do, you know, you're gonna have, hopefully, that we'll have less problems long term for those kids that have concussions.